Hello and welcome to this episode of On Geriatrics. Today we shall be talking about advanced directives. So what are advanced directives? Advanced directives are our wishes expressed in advance on how we would like the end of our life to be. Now most of us do not like to talk or even think about our death, but it is a reality from which we cannot escape. So why this concern at all, you may ask? The reason is that today there are technological advances that enable prolongation of life for a long time, ranging from days to even years, even though there is no hope for a recovery to a meaningful life. And these techniques, as many of you know, include artificial feeding, oral or through other routes, restoration and maintenance of heartbeat, ventilation to maintain breathing artificially. So such a person who is otherwise helpless and often not fully conscious has to be also supported for evacuation of urine and bowels. He has to be diapered, catheter has to be in place. He or she, from lying for long periods can develop painful bed sores. And it is a prolongation of a life of suffering and misery. In such a condition, he or she is unable to make decisions for his or her own medical treatment and has to yield to the medical care that is provided by the hospital, which focuses on prolonging the life at any cost. And the relatives also become helpless in this matter and have no choice but to follow the advice given by the doctors. Such care is usually provided in an ICU setting where the patient is isolated from his family and friends. The anxious relatives are also put to great physical, psychological and financial hardships during this time. To mitigate this, the Supreme Court of India has decreed that it is possible for a person to make his wishes for the end of his life care in advance, which he or she can put down in writing, just as one makes a will for one's property after one's death. And this advanced directives will have to be honored by the treating doctors as well as the family members. So who can write a living will? Any adult who is mentally normal or competent. In other words, he or she should not be mentally deranged in any way or suffering from a serious psychiatric illness like psychotic disorders or very severe depression, etc. Now, in this living will, one can also nominate a person or more than one person who, on behalf of the patient, in a situation where the patient is unable to make his or her wishes clear, can act on behalf of the patient, can speak on behalf of the patient, and try and implement the advanced directives that the patient has made known in consonance or with the cooperation of the doctors treating the patient. Now you may ask, is there a format for the preparation of the living will? Well, actually no. You can write it in your own words and express whatever you want and whatever you do not want in your own way. But it is wise to include the following points for clarity. 1. The circumstances when the living will shall come into force. Example, when the treating doctors feel that there is no hope for a meaningful recovery despite treatment, etc. What medical treatment is not to be provided and what medical treatment may be provided or is permitted. This can be explicitly documented. Where would one like to be treated? Whether home or a hospice or a hospital, and one may even make known what one's preferred hospital and the preferred treating doctor should be. The nominees who would have the power of attorney to act on behalf of the patient must be clearly indicated. One can find lots of details about end-of-life care at the websites of Pallium India and Vidhi Center for Legal Policy, including a link to a model format for advanced directives developed by the latter. So you would do well to check out these websites and the links. What is the process? The prepared document should be signed by 2 witnesses and countersigned by a gazetted officer or a notary. A copy of the document may be sent to the local body such as the municipality or the panchayat. One may then share the copies of the document with one's family members for their knowledge, as well as to the people you have nominated as a power of attorney, and if possible to your family doctor, so that there is ease of implementation. So friends, give a thought to this important part of our medical decision making. That is, what should be done when you are unable to express your opinion in a medical setting in order to avoid futile, unnecessary suffering towards the end of one's life. Thank you.